Vyvgart is part of a newer class of autoimmune medications that works very differently from traditional treatments like IVIG, but is it just as effective? And could switching treatments actually increase your risk of relapse? Camera's too far for me to do so ka-chink. All right, so let's talk about Vyvgart. This video is long overdue. Over the last several years, this medication has just gained a lot of attention in the neuromuscular world. And it was first approved for myasthenia gravis, and then more recently it's been approved as a treatment for chronic inflammatory demyelinating polyneuropathy, or CIDP. The reason it's getting so much attention is because it works through a completely different mechanism than many of the treatments that patients are already familiar with, again, like IVIG. And to understand why that difference matters, we need to talk briefly about how the immune system handles antibodies. And before your eyes glaze over, I will simplify this. Antibodies are proteins your immune system makes to recognize things that don't belong in the body, basically, like viruses, bacteria, cancers, other threats, toxins. It's like a SEAL team moving through looking for trouble. Virus neutralized, bacteria deep sixed, but antibodies are costly for the body to produce, so the immune system doesn't like to waste them. And your body's smart, so instead of throwing them away, it actually has a recycling program.
Yeah.
And that system is controlled by something called the Fc receptor, specifically a type called FcRn, and here's how it works. When antibodies start to break down, FcRn grabs them, pulls them back into circulation, and basically sends them right back out to keep working. Instead of being discarded, they get reused. So you can kind of think of the FcRn as a bit of an immune system taskmaster. Like, nope, you're not done yet. Get back out there. It's kind of like the dominatrix of antibody recycling. So instead of being thrown away, they're getting recycled. Most of the time that's a good thing because those antibodies help protect you from infections. But with autoimmune diseases, the immune system gets kind of confused. Instead of producing antibodies that attack viruses or bacteria, it starts producing antibodies that attach to healthy parts of your body. In myasthenia gravis, those antibodies interfere with communication between nerves and muscles. And in CIDP, they target structures within the peripheral nerves. So the problem isn't that the immune system doesn't have enough antibodies. It's that some of the antibodies being recycled are actually the ones that are causing the damage. And when the immune system keeps recycling them, the autoimmune attack can just keep on rolling, on and on, and on and on. And this is where Vyvgart comes in. Instead of adding antibodies into the system like IVIG does, Vyvgart blocks that recycling process, which means those problematic antibodies get cleared out of the bloodstream faster. So over time, the overall level of these IgG antibodies, which are the main type involved in many autoimmune diseases, starts to drop. And as those antibody levels fall, immune attacks on nerves or neuromuscular junctions can start to calm down. And you could almost think of this like if an autoimmune antibody is like a fire alarm that keeps going off for no reason. Vyvgart is a little like taking the batteries out of it so that it stops screaming at you at 2 a.m., basically. The system is still there, it's just not overreacting anymore. So if Vyvgart works by lowering certain antibodies in the bloodstream, the next obvious question is, well, how does it differ from IVIG? IVIG has been one of the main treatments used for autoimmune neuromuscular conditions like myasthenia and CIDP for years, but the way it works is almost an opposite approach. It's not almost, it is an opposite approach. Instead of lowering antibodies, IVIG floods the immune system with a large amount of pooled antibodies collected from healthy donors. And those antibodies interact with the immune system in several ways. They can block harmful antibodies, calm down inflammatory signals, and essentially reset parts of the immune response. So, if we simplify the two approaches, it looks something like this. IVIG adds helpful antibodies into the system to calm things down. Vyvgart lowers the level of existing antibodies circulating in the bloodstream, including the ones that may be driving the autoimmune attack. Two very different strategies aimed at the same problem. Now, this difference becomes really important when we start talking about CIDP specifically, because when Vyvgart was first being studied in this disease, there was a big question researchers needed to answer. If you lower IgG antibodies, will patients with CIDP actually improve, or could it make the disease worse? And this two-part question led to a really interesting clinical trial design. So researchers used something called a randomized withdrawal trial design. Instead of immediately comparing the drug to another treatment head-to-head, everyone in the study just first received Vyvgart to see whether their symptoms improved. And then the researchers did something very clever. Patients who responded to the medication were randomly assigned to either continuing to receive the Vyvgart or have the treatment withdrawn. And then the researchers just watched to see who relapsed. Because if the medication was truly helping, then the patients who stopped it would be more likely to worsen. And that's exactly what they saw. Patients who continued Vyvgart had significantly fewer relapses than those who were switched to a placebo. That result is what ultimately led to Vyvgart being approved as a treatment option for CIDP. So, what does that mean for patients? Who might actually be a candidate for Vyvgart? Well, right now, Vyvgart is approved for 2 autoimmune neuromuscular conditions only. As we've mentioned many times, myasthenia gravis and chronic inflammatory demyelinating polyneuropathy, or CIDP. But that doesn't mean every patient with those conditions will automatically be switched to it. In many cases, treatments like IVIG are still used as first-line therapy because it's been around longer and doctors are more familiar with it. And many patients do really well on it. Now, where Vyvgart may come into the picture is in situations where patients aren't responding well to IVIG, maybe they can't tolerate the IVIG side effects, or maybe they're just looking for an alternative treatment strategy. So rather than replacing existing treatments, Vyvgart just simply gives neurologists another option to work with. And in complex autoimmune diseases, having more options can make a huge difference. All right, so what about safety? Because if Vyvgart works by lowering IgG antibodies, then one obvious question comes up pretty quickly. If antibodies help protect us from infection, what happens when we drop their levels? All right, so in clinical trials, Vyvgart was generally well tolerated, but like any medication that affects the immune system, there are some side effects that we like to keep an eye on. The most common ones reported were things like headache, upper respiratory infections, fatigue, and reactions around the injection site or the infusion site. Now, most of these were mild to moderate at best, but lowering IgG antibodies can make people slightly more susceptible to infections. Now, that doesn't mean that people taking Vyvgart are constantly getting sick, but it does mean that neurologists will usually monitor things like infection symptoms and sometimes antibody levels over time. And this is another area where the balance of treatment becomes really important because in autoimmune diseases, the goal isn't to shut down the immune system completely. It's to dial the part of the response that's causing the damage down while leaving the rest of the immune system functioning normally and intact. So, how is Vyvgart actually given? So there are currently 2 versions available. The original version is given as an intravenous infusion, meaning it's delivered through an IV in your vein. Treatment is typically given in cycles over several weeks, followed by a break before the next cycle, depending on how symptoms are responding. More recently, a second formulation called Vyvgart Hytrulo became available. And instead of an IV infusion, This version is given as a subcutaneous injection, meaning it's just injected into the fatty area under the skin. It's kind of like an insulin injection, same concept. And that formulation combines the active drug with an enzyme called hyaluronidase, which helps the medication spread through the tissue and be absorbed more efficiently. So for many patients, this can make treatment faster and more convenient compared to traditional infusions, and it's often administered in a clinic or by a registered nurse. But in some cases, patients or caregivers can be trained to give the injection at home once they're comfortable with the process. All right, so ultimately, the overall goal of both versions is the same: lowering the level of circulating IgG antibodies so the immune attack driving the disease can calm down. It can calm the heck down. And this brings us to the question that we started with. How effective is Vyvgart for CIDP? And how does it compare to treatments like IVIG, right? So currently we don't have a direct head-to-head trial comparing Vyvgart and IVIG. So we can't really say that one is definitively better than the other, but what we can look at is how patients responded in the clinical trials that led to Vyvgart's approval. So in the ADHERE study, patients with CIDP first received Vyvgart to see whether their symptoms improved. And we talked about this a little earlier, but it's worth repeating. So those who responded then moved into the second phase of the study, which was the randomized withdrawal phase that we talked about earlier. And this is where things got really super interesting. Patients who continued Vyvgart were significantly less likely to relapse than patients who had the treatment withdrawn. In other words, once patients improved on the medication, stopping it made relapse more likely.
Shocker.
Now, we actually see something like this with many CIDP treatments because CIDP is a relapsing autoimmune condition. Treatment helps control the disease, but removing that treatment can allow the immune activity to return. So, I mean, let's give an analogy here. It's kind of like birth control. If you stop taking it, you're likely going to have another family member joining you in 9 months, right? And I get this question a lot from IVIG patients. And it wasn't until I did this video that I really commiserated with why they ask me this. I mean, I know why they ask me this, but so many people with IVIG, will say to me, is this something that I need to stay on for the rest of my life? And my answer usually is like, well, if it's helping you, yeah. And they're not exactly happy about that. But when you think about this, there are very few medications that you take a set duration of and it completely does away with the problem, right? I can only think of one right now. Antibiotics, right? You take your 7-day course or your 10-day course or your Z-Pak, and at the end of that, your infection's gone. But with most medication, the majority of medication, it's ongoing. Treatment is ongoing. So I never quite understood why somebody would think that for a progressive condition that is essentially incurable at this time, why they would be able to stop a treatment and expect it not to come back, possibly even worse than it was before they started the treatment. So anyway, that's my 2 cents there. But patients ask me that all the time. So with that in mind, the trial design helped demonstrate that Vyvgart was playing an active role in controlling disease activity. But because it wasn't compared directly against IVIG, neurologists just currently view it as more of another treatment option rather than an IVIG replacement. So it's kind of like, if it's not broken, don't fix it strategy. And if you're dealing with neuropathy or other nerve conditions, there's a lot more information on Lucid Med that can help you understand what's happening in your body and what treatment options might look like for you. And one thing I'll mention, If you're waiting for YouTube to randomly drop one of my videos into your recommended feed, you're probably missing out on a lot of content that could actually help you. At this point, I think there's over 350 videos on Lucid Med covering neuropathy, autoimmune conditions, IVIG therapy, nerve health in general. So if you're looking for answers, the best thing you can do is just head over to Lucid Med and look at the channel page and scroll through the videos and see if there are any topics that maybe you didn't realize were there and maybe connected to what you're experiencing right now. And if you want to better understand the emotional side of living with neuropathy, the anxiety, the frustration, the uncertainty, I did a very personal video about my own experience that I'll link right below in the description. So that's one I think a lot of people dealing with nerve disorders will really relate to. But with that, thanks for watching and stay healthy and lucid. And I still can't, ka-chink, I can't reach it. I'm getting punchy. I need to eat something. Okay. Most of the time, it's a good thing that they're getting recycled because, you know, they're just, I forget what I'm saying here. Okay. Ultimately, the overall goal of birth, oh my God. In many cases, treatments like, hi Sue Chung, you're interrupting my video. And knowing Sue, that's the first of probably 10 texts. Yeah, let's just sit here for a minute.